All right. And just so you know, just even though I may not cover all these again, like there are I've already gone or I uploaded these onto YouTube from what I did on Tuesday. So just I always advise you to like kind of start with a blank sheet if you can. I know I need to do better at clearing these out. But you can always like look at what I have presented on YouTube, pause it, and then solve it and see, make sure you get the right thing. But practicing the steps is really what this comes down to. And then Rachel, just so for your own like kind of feeling good about things, just know that this is new, right? So you actually haven't even practiced this yet, unless for some reason you did. The heparin protocol is new for you guys this semester. So let's go over it. All right, give me 1 second. All right. So what you're actually probably going to see when it comes to the protocol is you're going to see something that looks like this. You're going to get to this heparin protocol question, and it's going to start off by telling you the protocol, and it's going to tell you to bolus the patient, and then to start an IV drip, and then to answer the questions below the protocol. Now, when they say the protocol, the protocol is these 15 steps. What that means is you don't need to go through and answer every single one of these steps. It's just what the protocol looks like. And so that's why I have actually like crossed these out, and then I've even blacked it out, but I'll leave it like this for now. I crossed these out because you don't need to answer all these questions like the Gaiac stool, the neurochecks, the CBC. You don't need to answer any of those things. You just need to answer the questions that are down here. Calculate the bolus, calculate the infusion rate, and I'll show you how to do those things. So with this question, heparin is, and this is the standard weight-based heparin protocol. What you're going to be doing is you're going to be given a patient's weight. In this example, it's 156 pounds, and you're going to convert it to kilograms. So 156 divided by 2.2, and then you get 70.9 kilograms. Okay. And then I even leave that here in the protocol, but you don't need to write in the protocol. It's just kind of like the way I look at this is like it's like a laminated sheet of paper that's in the room for where you're doing these like heparin things. So it's kind of like just your ability to kind of navigate the information that's there. And I know it's overwhelming. Then it'll give you your availables. So what's available is 25,000 units and 250 milliliters half normal saline.
Can I ask you a question?
Yeah,
Okay, so for instance, on the exam, is it going to show up with all these steps?
I think so. It's not and that's I take 100% blame for that, because when I had updated the exams back, I don't know, it's probably 2016, 2015. It was a while ago. Um this is how I added it to the exam, and that's why I'm telling you, like, you can immediately ignore steps 3 through 9, because this is, like I said, just the standard. So if you do a Google search for weight-based heparin protocol, this is what you'll see.
Okay, next question.
Yeah.
For every heparin question, is it going to be 25,000 units? Or
For
that number will change?
if it's standard, if it's a standard heparin protocol, it will always be these availables. So the
Okay.
25,250 and the 1,000 per mil for the bolus.
If it's heparin, that's what it will be.
If it's the heparin protocol.
Oh, protocol. Okay.
Yeah, because you'll have, like, if you look at the practice sheet, you have some other heparin questions. Like this one, it says 0.45% normal saline, 250 ml, 25,000 units. It happens to be the same,
Okay.
but here it's 500 milliliters, 20,000 units. So you can have variations, but if it's the protocol, it should be the same. It should be what is listed here, the 25,000 units, 250 ml. But I would always say, you never know what your instructor might do. They might change those numbers. They might make it 25,000 units and 500 ml. You just go off of what the protocol shows. But over the years, so far, from what I understand, those are the availables.
All right, perfect. Thank you.
Yeah, good questions. All right. So the available for the standard heparin protocol is going to be 25,000 units in 250 milliliters, half normal saline. And then they'll also give you another available is your bolus. So your bolus is actually 1,000 units per milliliter. So those are two different availables, like having two different medications. You have your insulin, or you have your IV bag, and then you have a separate bolus dose available to you. It repeats what it says at the top of the protocol down here in step 10. And basically what this is telling you is how you start this patient on heparin. You're going to bolus them with 80 units per kilogram body weight, and then you're going to start a drip at 18 units per kilogram per hour. Again, that is what seems to be the standard for the weight-based heparin protocol. And then, but I always say, like, if they tell you or they give you different information, the way I'll show you how to do this, you'll be able to figure this out. You just got to plug in the information like you would be solving for any other milliliter or any other flow rate type question. We'll get into 11 through 15 in the second part of this, but this is just what could potentially be an additional question. Now, on your test, what you're going to get are two questions that will count as one question. So, like, let's say this is question 20 on your test. It'll say 20 and it'll say answer, or calculate bolus and calculate the infusion rate. So you'll have two questions, but it only counts as one. So if you miss them both, you've missed 1 point. If you miss one, you've missed 1 point. And if you miss neither, then you get the full point. So you can treat it as like it's like a half point each, but they're not going to give you a half point. It's an all or none sort of thing. So what I'm going to do is I'm going to delete my work here and we're going to work through it. All right. So when we're calculating the bolus, we're just going to use the information that the protocol states, and then I'm going to have you replicate this with the different patient, different weight, but it's the same things to do. So we are given that it's a 156-pound patient, and step one of when we're doing this heparin protocol is to calculate the patient's, or to convert the patient's weight in pounds to kilograms. So I already did that. It's 70.9. So I'm going to write that down for my bolus. The second thing is, what are we bolusing? Well, it tells me to bolus with 80 units per kilogram. So that's what I'm going to do is I'm going to now multiply the 70.9 by the 80 units per kilogram. And what that's going to do.
I'm sorry. Whenever I solve these, okay, like I understand like the cross multiplication and stuff, and that really helps with like the units and stuff, but I have a tendency of like unfortunately just like kind of doing it not necessarily in my head, but I don't know how to explain it. So like I'm gonna ask a lot of questions because I don't know. I'm sorry. I'm just
You don't need to apologize. Are you getting the right answer every time?
Well, I passed the first two drug calcs, but this is a whole different thing for me right now.
Yeah, this is a
So,
different animal. Yes. So I will say the first two, well, first of all, like you want to treat this like you treated the flow rate questions. So like I always tell students, like when I look at this, I also do it in my head, but I can't just tell you what I'm doing in my head, not write anything down and just give you an answer and expect that you know what I did. And so I
right.
always use dimensional analysis as the tool to organize the data so that I'm not, I can show you, and then you can kind of see, okay, I don't quite understand if you're not a dimensional analysis person. I don't understand everything that you're doing with the dimensional analysis, but I can at least see what you are trying to show me and where you're getting these numbers from and how you would organize it. But yeah, I do it in my head as well. And I would just say, as long as you're getting the right answer, you're doing it right. So there's no one correct way to do it. I just show you the way that's easiest for me to draw out and show it to you. But yeah, ask away while we're going through, because I'm
Okay.
certain other people have similar questions. So,
All right, perfect. Thank you.
all right, you're welcome. So, step one is you need to calculate and find out, or you need to deal with the patient's weight. And we need to take the patient's weight in kilograms and multiply it by 80 units per kilogram. Now, sometimes I'll just go ahead and like do that calculation, and that's what I'm gonna do now. Sometimes I will just do like a times and then make like a really long dimensional analysis, but it's really up to you and what your preferences are. So I'm gonna take 70.9 times 80. And I'm gonna get 5,672. So at this point, I am in units, because that's how heparin's measured. Heparin and insulin are measured in units. But the question says, calculate the number of milliliters to administer for the bolus. So I need to have a way to convert units to milliliters. And so what I'm going to do is I'm going to go to step 2 of the protocol where it listed my available. So I have two strengths available. I have the 25,000 units and 250 milliliter half normal saline. And then I also have the bolus dose. Since we're calculating bolus, we're going to use the bolus dose. Does that make sense?
Yes.
So, and forgive me, I do ask rhetorical questions a lot, so you don't always have to answer me. um, so what we're going to do is we're just going to set up another conversion. Again, if you do this differently, that's perfectly fine, but I always show it the slow tortoise way, because that way you know like where your numbers go when I draw it out. If you already have a good grasp on that, which it sounds like you do, then just roll with that. You don't need to change anything. But if you're doing these and like 10% of the time you're getting the wrong answer, then you want to make sure that you kind of find out why you got that wrong and make sure you don't make that mistake when you're obviously taking the test. So the bolus dose was 1,000 units per milliliter. And so I'm just going to take my 5,672 divided by 1,000, round to the nearest tenth, and I'm going to get 5.7 milliliters. So I would get 5.672, rounded to the nearest tenth would be 5.7. So if you're given the standard weight-based protocol, which I think you will be, the only thing that really changes in the setup of this question is the patient's weight. So do they weigh 80 kilograms? Do they weigh 30 kilograms? Do they weigh 90 kilograms? That's really the only thing that changes. You multiply that number by 80, divide by 1,000, and then that's your answer. As long as the heparin protocol isn't changed and the availables are the same, then that's what it would be. But I would always, read and double check and make sure, because I have seen heparin questions where they've used different availables, but it wasn't the standard weight-based heparin protocol. It was just a different type of question. All right. So I think most people kind of get bolus it's pretty straightforward. I think most people get the bolus question. So let's try the infusion question. So the infusion question is, it wants us again to calculate milliliters per hour, but it says to start at 18 units per kilogram per hour. So this is one of those things where like it just seems like a weird kind of, denotion here, but you've seen this before. In 130, you had weight-based calculations where you had to account for the patient's weight. So it was like, you're going to give them 30 milligrams per kilogram body weight, and then it's not different as far as that's concerned. Same thing you did up here with the bolus. But in this instance, we're going to take our patient's weight, and then we're going to multiply by the infusion rate. And the infusion rate's always going to be whatever gives you a time like element. So like flow rate was milliliters per hour, drop rate is drops per minute. It will say to calculate like a drip rate or the IV drip. When you see what we get as our final answer, it'll make sense why it's called that, even though you're not dealing with a drop rate, like drops per minute. So I'm going to take that 70.9 divided by or multiplied by 18. That gets rid of kilograms. When I'm done, I'll be in units per hour. So 70.9 times 18. And I get 1,276.2. 1,276.2 units per hour. Now, again, it doesn't say units per hour. It wants to know how many milliliters per hour. And so what we're going to do is we're going to need to convert units to milliliters. And we have a way to do that. When I go back up to my available says we have heparin, 25,000 units, in 250 milliliter half normal saline. We also have a bolus dose available, but I don't care about that right now because I'm not calculating the bolus. I'm calculating what to put into my infusion rate, right? What am I plugging in? So they're already connected to the IV. Bolus is the push that we put in while they're on the IV. Now we're setting the IV to make sure they get an adequate amount of heparin while they're dealing with what's causing their clotting issues. So I'm going to put in the 25,000 units, and I'm going to put in the 250 ml. Now, it just so happens that I just because I've been working with this for several years now, 250 over 25,000 is just 1 over 100. So that's how I know kind of when I come up with my answer here, which gives me an answer of 12.8 milliliters per hour. And what I did is I rounded to the nearest tenth. So 1276, 7 rounds up to 8. And so I get 12.8 milliliters per hour. If someone was on an infusion at 12.8 milliliters per hour, it would be dripping out very slowly, right? Because think about what is 12.8 milliliters. That's less than a tablespoon in an hour. Okay. So it's going to be dripping out very, very slowly. But you're not using a drop factor, which is why you don't calculate drops per minute. So most likely that's the question you're going to get, is just to calculate the initial bolus and to calculate the initial infusion rate. And you're just going to use the weight-based protocol to do that. Go ahead.
After we do the one that you saved for us after this, can we go back to like a drip, like a practice for the drip or for the drop factor?
Yeah, absolutely.
Okay, thank you.
Now I will say the way that I've kind of rewritten this, unfortunately, I don't think that they're going to be utilizing this yet. I'll given the opportunity, I'll get it out to your instructors, but I don't know when that's going to happen. So I rewrote the heparin question without the table in it. So you can see I gave you the order, and then I gave you the available, and then you have the patient's weight. So you have all the information you need right there without having to look at all the different numbers of the protocol. So just so you know, I'm slowly trying to get this to be administered into your test. I just don't know who to give that information to yet. So we're still working on it. The other thing is sometimes we'll see like they might give you just these two questions, the bolus and the infusion rate. They might also give you and tell you a scenario like, okay, they've been on an infusion. They've been on it for 6 hours. We test their clotting time and we find that it's 43 seconds. And then that's where you use the other steps of the protocol. So 11 through 15, you use those steps to tell you what to do next. Or sometimes you don't even know what you did initially because you're just coming in after 6 hours. So if you got a question like that, I don't think that you will, but I added it in there as an extra challenge. You're going to do the same thing. You're going to follow, you're going to use the same availables, the same, IV, the same bolus. The only differences are, what is your new bolus? So is it 80, is it 40, or is there no bolus? And then what are the changes to the infusion rate? So I stated in the sample questions, I usually go with the 43 seconds. That way you're getting 4 different problems to practice. And the reason I choose the 43 seconds is because it gives you 2 things to do. Rebolus with 40 units. So instead of 80, it's 40. And then to change the rate of the infusion. The initial rate of the infusion was 18. So if we're increasing the rate by 2, 18 becomes 20. And then I'm just going to leave it at that because I want you to practice the other one. But basically, you'll see here that I took the same patient weight, 70.9. This time I multiplied by 40 units per kilogram to get these units, and then divide by 1,000 because that's my bolus dose strength, with a final answer of 2.8 milliliters. So, I'm just trying to shortcut and show you what we did for this scenario. I just used the data that was in the table, and then I made it simple in the example question that I'll give you because everything's right there. You can see it.
Will you scroll up a second just so I can see where you got the 40 units per kilogram?
Yeah, it's right. It's in the table. So like if you look at step 12, step 12 says if your APTT is in that range, then you're going to follow the steps that are listed here. Rebolus with 40 and then increase the rate by 2.
Okay. Will you scroll back down? I'm
Yep.
sorry.
No, you're good.
Okay, so you did the 40 units, and then it said to increase the rate by, or the units by 2. So, what do you, when it says that, like the 70.9 times 40 units, is that the 2836, or did you add an extra 2 units?
No, this is the bolus. So the bolus was 40 units.
Okay.
The adding the 2 units per kilogram per hour, you add the 2 units per kilogram per hour to the 18 units per kilogram per hour that you started with, right? Because your initial infusion was 18, and now we're going to add 2 more. So 18 plus 2 is 20, and that's where that comes from.
Oh, okay. That's the second. Okay.
So you would need to know like what the initial infusion is, because like let's say they're on day 35 of a heparin protocol and they're currently at 16 units per kilogram per hour, and then it tells you to increase it by 2 or decrease it by 4 or whatever it tells you to do. So we're making an assumption that this is the first 6-hour interval, but usually that's why I'm saying I don't think they're going to ask you this question. But if you don't know anything else, you know that you started at 18, so you just add or subtract depending on what it tells you to do.
Okay, will you scroll back up to the thing real quick? Okay, so it is 40 units per kilogram, increase rate by 2 kilograms per hour. So the rebolus is with the 40 units kilograms, and then the other ones that add the 2 units kilograms per hour.
Yep.
Okay.
So yeah, remember, anytime we're dealing with a rate, then that tells you that's your ml per hour, your flow rate. And if it's rebolus, it's just one time, and your answer is going to be in milliliters.
Okay.
So let me go ahead and have you guys both work through this one that has no writing associated with it. And then you can see the whole thing here. So just focus right now on this these two right here, and then we can come and do that one afterwards if we need to. But go ahead and get your answer for the bolus and get your answer for the infusion rate and just write it into the chat once you get it. All right, so since you both answered A already, you should get 4.8 milliliters for the bolus.
Okay. So I just finished, well, I think I did. I don't know. I got a little confused at the end. For B, is it 10.8?
Yep. Yep.
And then what would okay, so if I canceled out units, so that'd be milliliters per hour.
Got it.
Okay.
Yeah, so and if you ever get so the bolus dose seems to be consistently in the like kind of like a smaller range, even as you get like a larger adult, like because 4.8 for 132 pounds, even if you double that patient's weight and they were 264 pounds, you're still going to get like 10 milliliters. So if you get something over 10, just kind of double check your work, make sure you didn't use the heparin available or the IV bag available versus the bolus dose. So that is something that will get mixed up sometimes. Okay. So go ahead and try this next thing here, which is the rebolus with 40 units and increased by 2. So notice that I simplified it for you and I just told you to rebolus and to increase the rate, but we're basing it off of the same 132-pound patient. So go ahead and do those and see what you get.
5 and it's okay, thank you.
You're welcome. Yeah, and you can miss 2. All right. Yeah, let's do this one since I haven't worked it out yet. So in order to calculate drop rate, you need to know 2 pieces of information. You need to know flow rate and you need to know a drop factor. So that's a good clue that you're dealing with a drop rate question, is that it will have a it'll have a drop factor listed for you. Flow rate is typically milliliters per hour. It could be milliliters per minute, and now I'll kind of help you distinguish when to use that. Drop factor is drops per milliliter, and drop rate is drops per minute. And so when we calculate a flow rate and we calculate a drop rate, you just need to make sure you have these 2 pieces of information. So it tells you you are to administer an IV solution at a rate of 75 milliliters in 25 minutes, and then to look at the label for your drop factor. So all you're going to do is take the volume, 75, over the time, 25 minutes, and then multiply it by the drop factor. And you'll get 45. Where this kind of changes a little bit is like, let's say it told you 75 milliliters in an hour. Then you would want to put 75 over 60 minutes or make sure you convert hours to minutes because you're looking for drops per minute. So why don't you try 17 and see if you got it.
25 drops. I got 25 drops, but what would it be milliliters or they're asking for minutes? So what did I do?
So remember, you need your flow rate
Okay, 75 milliliters over 30 minutes.
times your drop factor.
Okay,
Oh,
I didn't put it over milliliters because
yeah.
milliliters would cross out.
Mhm.
And
And,
then,
and they're there, like even on the label, it says 15 drops per milliliter, 10 drops per milliliter. But even if you didn't, obviously, if you didn't incorporate it, you're fine. The only time that might be a problem is if like you got a question that said, you know, 20 or 250 milligrams per 2 milliliters or something like that. You just want to make sure you pay attention to that for those types of oral based medications, but I'm sure you'll be fine.
okay, so was the answer 25 drops,
Yeah.
correct?
Mm-hmm. Drops per
But
minute.
it would be drops per minute because what is the correct drops per minute flow rate? So drops per minute. Okay.
Anytime you see that you're calculating a flow rate, there needs to be some time listed there. Like if I told you, how fast were you driving and you told me I was going 20 miles, it doesn't make sense, right? You got to say
Right.
I was going 20 miles per hour. So milliliters per hour, drops per minute. And Alina, I know you put 51. Are you seeing how to get 25?
Actually, not. I'm kind of lost. Yes. So dropped. Just a second. Flow rate. We found like so we need a flow rate, right? And a flow rate is a drop rate divide on drop factor.
No.
Right?
Flow rate is just volume and time. So for this question, it's just 75 milliliters over 30 minutes.
Oh my God, I look at a completely different. I didn't understand. Sorry. I understand right now. Yeah, a completely different question. Sorry.
Okay, yeah, I figured you must have been looking
Yes.
at different numbers.
Yes, I'm on different.
And you both did a good job of not including the medication, the solumedrol, because you don't need to know the milligrams when you're calculating a flow rate. That's important that you're giving the patient the correct medication. But when you're calculating a flow rate, all you care about is the volume and the time and the drop factor.
Yeah, I understand now. Thank you.
Yep, you're welcome.
All right, so you'll be back on tonight, correct?
Yeah. So I have for 2:20, 2:30, I'll be on it at 5. So from 5 to 6.
Okay, and then where will your video, or are you going to upload your videos anywhere?
Yeah, the ones I did on Tuesday are up on YouTube already. And then when I finish tonight, I'll either post them up tonight or most likely tomorrow.
All right, perfect. Thank you so much.
You're welcome.
Thank you.
Have a good day.
You
Thank
too.
you.
Yeah, you're welcome. Okay.